Hey guys, welcome to our channel Nutrition Media, where we cover different health-related topics, so we together can live a healthy life. And so, in this video, we are going to talk about telogen effluvium. Telogen effluvium is cause of temporary hair loss due to the excessive shedding of resting or telogen hair after some shock to the system. New hair is still growing. Due to the shape of the root, telogen hair is also referred to as a club hair. It should be distinguished from telogen effluvium, in which hair shedding results from medicines, chemicals, or inflammation preventing anagen or active hair development. The tip of anagen hair is pointy or tapered. Now, what is anagen? Anagen is the active phase of the hair. The cells in the root of the hair are dividing rapidly. A new hair is formed and pushes the club hair up the follicle and eventually out. Here you can see some examples of telogen effluvium. Now let's talk about who gets telogen effluvium. Acute telogen effluvium can affect people of all age groups and both sexes. Chronic telogen effluvium with no clear precipitating cause tends to present in otherwise healthy women 30 to 60 years of age. Let's have a look on the cause of telogen effluvium. In a normal healthy person's scalp, about 85% of the hair follicles are actively growing hair, and about 15% are resting hair. A few hairs may also be in catagen. The meaning of catagen is a short transitional phase of the hair growth cycle between anagen and telogen that usually lasts between 10 to 20 days. A hair follicle usually grows anagen hair for 4 years or so, then rests for about 4 months. A new anagen hair begins to grow under the resting telogen hair and pushes it out. Thus, it is normal to lose up to about 100 hairs a day on one's comb, brush, in the basin, or on the pillow, as a result of the normal scalp hair cycle. If there is some shock to the system, as many as 70% of the anagen hairs can be precipitated into telogen, thus reversing the usual ratio. Typical triggers include childbirth, physiological neonatal hair loss, acute or chronic illness, especially if there is fever, surgical operation, accident, psychological stress, weight loss, certain medications, endocrine disorders like hypothyroidism, overseas travel resulting in jet lag, skin disease affecting the scalp, excessive sun exposure. Now let's talk about the clinical features of acute telogen effluvium, so we can differentiate between the acute and chronic telogen effluvium. Telogen effluvium is an unscarring form of diffuse hair loss with no clinical or histological evidence of inflammation and can affect up to 50% of the scalp hair. The resting scalp club hairs remain firmly attached to the hair follicles at first. The new hair coming up through the scalp push out the resting club hairs, and increased hair fall is noticed 2 to 4 months after the triggering event. Thus, paradoxically, with this type of hair loss, hair fall is a sign of hair regrowth. As the new hair first comes up through the scalp and pushes out the dead hair, a fine fringe of new hair is often evident along the forehead hairline. At first, the fall of club hairs is profuse and a general thinning of the scalp hair may become evident, but after several months a peak is reached and hair fall begins to lessen, gradually tapering back to normal over 6 to 9 months in most cases. As the hair fall tapers off, the scalp thickens back up to normal, but recovery may be incomplete in some cases. Because nail and hair growth are under the same influences, an arrest in hair growth is often mirrored in the nails by a groove across them coinciding with the time of the shock to the system. The time of the shock can be estimated from the fact that a fingernail takes 5 months to grow from the posterior nail fold to the free edge. So if the groove in the nail is halfway down the nail, the shock must have been 2.5 months ago. Chronic telogen effluvium. In some patients, hair shedding continues to be intermittently or continuously greater than normal for long periods of time, sometimes for years. The hair cycle appears to be reset so that the anagen period is shortened. Chronic telogen effluvium often presents in women that actually continue to have quite thick and moderately long hair. This is because they notice the shed hair more than those with finer or shorter hair. Telogen effluvium does not cause complete baldness, although it may unmask a genetic tendency to genetic balding like female pattern hair loss, or in men, male pattern hair loss. The mechanism of chronic telogen effluvium is not well understood. Middle-aged women with a long fluctuating course of telogen effluvium, producing widespread thinning lasting many years, have normal hormonal studies. Now let's see how is telogen effluvium diagnosed. Telogen Effluvium is usually diagnosed by its clinical features. Hair thinning involves the entire scalp loss of other body hair. Examination shows diffuse thinning without focal areas of total alopecia and short hairs of normal thickness. A gentle hair pull test reveals an increased number of hairs. Most are telogen with the typical epithelial sac. A trichogram can help confirm the diagnosis. More than 25% telogen hairs in a trichogram strongly suggest Telogen Effluvium. Light microscopic examination shows club hair. A scalp biopsy is rarely needed. It is expected to show normal terminal vellus hair ratio. So, that was it for today's video. If you have any other questions related to Telogen Effluvium, you can comment in the comment section below and let us know about your queries. Also, if this video was helpful, make sure to like the video and subscribe to our channel. And click that bell icon for more videos like that. See you in the next video.